I have a patient came in, normal, common low back pain, sciatic type pain. It's mainly on the left side. He gets numbness, tingling in the normal sciatic distribution into the butt, sometimes into the back of the hamstring. Most of the time, people don't work out properly. They don't do a lot of exercising. He lifts a lot of heavy weights, so I'm thinking that's why he has the problem. So we're doing a lot of posture work. So the normal treatment for him is we're going to heat up the area to get the blood flowing. Have the hot packs here, so we put one of these on right over the low back. Basically 8 to 10 minutes. I'm gonna do an abridged treatment today for the purposes of this. So basically, I put that on there. 10 minutes. Set the timer. First, you want to heat up the plate wherever his pain is. If his hip, his shoulder, you want to heat it up first. Get the blood flowing. Speeds up the metabolism. It gets the cells working faster. Just promotes healing. So once the timer goes off, about 8 to 10 minutes, I take the heat pack off. Next thing you want to do, you want to massage the area where his pain is. So say he's got pain right in the left side. This is where the sciatic nerve exits the spine and serves the leg. So, you'd want to find, where's that tender? Let me know when I'm hitting the tender spot.
Right there.
Right there. So you want to kind of pinpoint the tenderness. You want to do a little cross friction massage. Again, this speeds up healing, gets the cells working. The cells are in the area designed to clean out the inflammation. So what I do is just promote healing. I speed it up. People, the more they come in for treatment, the faster they're going to get better and get on their feet. So you massage it a little. Sometimes I use a couple different lotions. This is called the Massage Star. It gets a little deeper than my thumb. So after that, what I do, basically there's a couple cardinal exercises for common low back pain. Number one would be a simple thigh extension. I'm going to have you contract your glute mainly, raising your thigh off a couple inches off the ground for a 3-second hold. A little higher. 2, 3, 1, down. Now you're going to switch. You're going to contract the right glute, raising the thigh. 2, 3, 2, down. Now we'll go to the left. 2, 3, 3, good. You get any pain with that?
No.
All right, keep going. Go to the right. 2, 3, 4. Let's do 2 more. Go to the left. 2, 3, 5. Down. 1 more. 2, 3, 6. So basically, you can take a rest. Basically, we're strengthening the glute max and the lumbar erector muscles of the low back. So we're going to strengthen up the area. A lot of people do more abdominal type work and they don't strengthen this area. That's another reason why at least 80% of adults complain of back pain at least once. So we would do about 20 reps. Second, what I'm going to have him do is you're going to go right side down, facing me. So you're going to lie on your right side. Basic side posture adjustment for your lower back. His pain is more on this side, so I want to stretch that area. Just slide this table up. You can slide a little bit down the table. Okay, so you're lying on your side. You're going to, bottom leg is going to stay straight. You're going to bend that knee. Just relax your head on there. Slide towards me. Okay, so now, basic side, I just want to get a stretch into that area. A lot of times when you have pain and inflammation, the joint kind of gets locked up, scar tissue forms, so you want to make sure you stretch out the joint. It's kind of like use it or lose it. That's why you want to just make sure you stretch. So basically, I'm just taking them this way. Sometimes you'll get a little pop right in there. That's your basic chiropractic adjustment. All right, now you're going to go onto your back. All right, now, knees are bent. One of the most important rehab exercises you can teach someone that has low back pain is to contract the deep abdominal muscles. And it's a small contraction. Basically what you're going to do, naturally you have an arch here. So when you lie on your back, if you slip your hand under your low back, you should feel a little arch. So basically what I'm going to have him do is, you're just going to pull your low back into the table, contracting your stomach muscles for 3 seconds and hold. Now the mistake a lot of people make is they'll kind of suck in their stomach. That's not what I'm looking for. It's basically, it's kind of to contract, as if you were going to get punched in the stomach. But I have them hold it for 5 seconds while you're holding the contraction. So throughout the day, when you're standing up walking around, you kind of keep your stomach tight, and that keeps the height in here, because we all know the nerves come out horizontal to the spine, especially the sciatic nerve. So if you keep your gut loose, everything compresses. If you keep it tight and stand tall, there's going to be less compression on the nerves, and that's what causes the numbness, tingling going down the leg. So try it one more time. Just pull in tight and hold for 5 seconds. 1, 2, 3, 4, 5. Good. Any pain with that? All right, try it again. And breathe while you're doing it. That's the key, to teach them how to contract the muscles and breathe while they're doing it at the same time. I have people, we build up to holding it for 10 seconds, 20 seconds. This way throughout the day when they're walking around, their stomach's tight and they start to not think about it. They just do it subconsciously. All right, relax. Another basic exercise is a low back bridge to strengthen the glute max back here. I would have you contract your glutes, and you're going to just raise your pelvis up. Squeezing the glutes. 2, 3, 5 seconds, 4, 5, down. Any pain with that? Lower the headrest a little for you. And let's go one more time. Raise up. 2, 3, 4, 5, down. And one more time. 2, 3, 4, 5, down. Now I showed you 3 of the cardinal exercises to do. The last one is just a basic crunch. You're gonna have your arms here. Again, you start by pulling your low back in, stomach tight, and then you just raise up a little, clearing your shoulders off the table. Nice and slow. 1, good. We'll do 5 of them. 2, and normally I'd work up to about 20. 3, depending on how much pain the patient's in. 4, but people respond quickly to this treatment. A couple visits already, the numbness, tingling starts to go away. Relax. Arms down. All right, now, so those are your exercises. We finished with some ice and stim. After you heat up first, exercise, stretch, adjust. You always want to finish up with some ice. So basically, I'm going to have you lie on your stomach. So if his pain is down on the left side, I'm going to hook 2 stim pads up. Basically, we hit the origin and insertion of the glute max. That's the main muscle that gets inhibited with this kind of low back pain. So I'd put 1 pad here, 1 pad here, turn on the machine for 10 minutes, and I'd have the ice pack right over that, kind of freezing up the area to dull his pain, and that's about it. I tell people to come in 2-3 days a week. This is just conservative treatment for low back pain, and we get pretty good results. Thank you.